So who's up next, Gina?
Gail Spencer.
Oh, it's just a routine checkup. Should be quite straightforward. Ah, Gail. Come and sit down. Thank you. You seem a bit short of breath. Are you okay?
All right, not too bad.
Is it your asthma?
Yeah, I'll be okay soon.
Have you used your puffer?
No, I ran out on Sunday. I've got a new one, but I left it at home.
I'll get the bag. There's an inhaler and a spacer in there.
Can you bring the oxygen as well, please, Gina? Gail, I just need to check how severe your attack is, okay? I'm just going to check your pulse and your breathing rate. How long have you been short of breath?
15 or 20 minutes.
Do you know what triggered the problem?
A cat in a box.
Have you started with any skin rash or swelling since you became breathless? Well, we've got a blue puffer and a spacer on the way, okay? You're actually breathing quite quickly at 22 times a minute. Your pulse is high at 98 beats a minute. Gina, can you set up the inhaler and the spacer and the peak flow meter, please? Can you also set up the pulse oximeter? And just pass me the manual. Thank you. Just want to double check something.
Okay, cat's on standby if we need her.
Okay, thanks. I think we're okay for now. Thank you. Gail, we just need to check your peak flows before you have any salbutamol, okay? Do you know what your peak flows normally are?
430, 440.
Okay. You know what to do.
Just move your finger off the pointer.
Just try and sit a little bit more upright, okay? And breathe in as deep as you can. Breathe out as hard and as fast as you can. Well done. Thank you. 275. You just take your time. You ready for another go? Okay. So breathe in as deep as you can. Thank you. Breathe out as hard and as fast as you can. Well done. That's 295. Sats 96% on air and pulse 103, Gina. You just take your time, Gail. We'll do one last go when you're ready, okay? You okay? Okay. So breathe in as deep as you can. Breathe out as hard and as fast as you can. Well done. Okay, so 270. 295 was the best one, Gina. So that's well above the level. That would be a worry, okay? So there's the puffer. Should make you feel more comfortable.
I've written all that down.
Oh, thanks, Gina. Can you help Gail with the puffer, please?
And breathe out. And breathe in. Great. And breathe out. Okay, have a couple of more breaths. Gail, you're doing really well. That's really great. Good. See if you can hold your breath a bit longer this time. Well done. A couple of more times. Is that starting to feel any easier?
Yeah, a bit better.
Sats of 96% and pulse 104. Thanks, Gina. If you can keep updating the board, please. First 4 doses of salbutamol given at 11:15. Gail, you're doing fine, okay, but I do need to check your breathing again. Okay. Your pulse is starting to drop down, which is good, and your oxygen levels are fine, okay? And your breathing's also returning to normal, which is good. How are you feeling?
Feels easier.
That's good. Just let me know if you need to use the puffer again, okay? Respiratory rate of 15 times a minute. Pulse is 80 beats a minute and oxygen saturation of 97% on air. So that's all good for you, okay? It's 11:22. How are you feeling?
Very much better, thank you.
That's good. So what was all this about, a cat in a box?
Well, I was on the bus and this woman came and sat next to me. She had a big cardboard box and she'd put it on her knees. When I got off, she had to move the box. and it meowed. Cat set my asthma off.
Oh, it's really bad luck. We're over the worst of it now though, okay? So you just relax, take it easy.
Kath's told the next 2 patients that you're busy and they're happy to wait.
Oh, thanks, Gina. That's much better. 390, best of the 3 peak flows now. Pulse 75 beats a minute and respiratory rate of 12 a minute. Oxygen levels are fine, thank you.
I've written that down. It's 11:28.
That's better. I get scared, you see, then that makes my breathing worse. I keep well away from cats, so I couldn't believe it when I heard the box meow. My mum will be mad that I didn't have a working puffer with me, especially as it sat on the chest of drawers in my bedroom. Thing is, I've been pretty good with my asthma lately, so I wasn't bothered about carrying it around so much.